In this module, we will examine schizophrenia, its symptoms, possible causes, and treatment. DSM-5 made some important changes to the diagnosis. For one thing, they removed the subtypes from the category. Although the terms have been updated in the previous version of the DSM, the subtypes of paranoia, disorganized, catatonic, and undifferentiated were still nonetheless linked to some of the original and now outdated formulations of the disorder. Moreover, research indicated that they were not reliable or valid subtypes. There was too much overlap to consider them as distinct. In other words, they were too similar for the distinctions to be of any meaningful use in terms of the course or treatment of the disorder. When I worked in the mental health field, I worked for a program that ran 2 residential support facilities. Most of these clients were diagnosed with schizophrenia. I quickly learned that I had some stereotypes and misconceptions about people with chronic mental illness. The big one was that they were violent, dangerous, and unpredictable. However, once I came to know these folks, it was clear that I was probably safer living with these crazy people than I was walking the few city blocks from my apartment to work. I think that there are a number of factors that contribute to the stereotyping and misunderstanding of the mentally ill. One, of course, is a lack of factual knowledge. Mental illness is often portrayed in movies and on television in highly biased ways. From a young age, we see characterizations of the mentally ill as scary and dangerous. Look at the villains in any Disney movie. They're often portrayed as crazy or mentally ill in some way. It also doesn't help that the only times we see someone with mental illness in the news is because they've committed some sort of violent act. Consider the Sandy Hook shooting, for instance. Of course, events like this make headlines because they are so shocking and tragic. The fact is, however, that such events are rare. You'll never read a headline or see a story on the news about the millions of mentally ill people who never harm anyone, except maybe themselves, which is far more likely. Another factor is that the behavior of the mentally ill can seem so strange to us. We see someone walking down the street talking to himself and we think he must be crazy, because we know better than to voice our internal dialogue to strangers. One of the hallmarks of schizophrenia, however, is what's called a lack of insight. In other words, sometimes people with psychotic disorders do not realize that their symptoms are not normal. I think, however, that one of the most significant reasons why we still harbor stereotypes and misconceptions about the mentally ill is because we do not really want to know them better. We do not want an opportunity to find out that maybe they're not so different from us. When I was working with the chronically mentally ill, I worked nights at the psychiatric hospital, and during the day I worked at a university counseling center. There were many occasions when, in talking with my college student clients, I could tell how tenuous their functioning was and how close they were to needing to be hospitalized. Likewise, there were many instances when it seemed to me that some of the patients in the hospital could likely be college students. It left me with a strong impression that the line between sick and well can be a very thin one indeed, and that any normal person could slip into mental illness if the circumstances were right. The point I'm trying to make here is that mental illness, especially psychotic disorders, can seem very scary. Schizophrenia usually strikes right at the time when a person is coming into his or her fully developed sense of self. It must be incredibly scary to feel oneself slipping away and not be able to do anything about it. If we can empathize with someone who suffers from schizophrenia, it can create a kind of need to distance ourselves. It feels safer to make a false dichotomy between us and them than to think that we too could lose our mind. So if you find yourself distancing from the people you're learning about in this module, just consider that maybe, just maybe, there but for the grace of God go I.